Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the anatomy of the abdominal aorta. The abdominal aorta is a continuation of the descending thoracic aorta. It begins at the aortic opening of the diaphragm as a midline structure at the level of the vertebra T12. It passes in front of the bodies of lumbar vertebra 1 to lumbar vertebra 4, midline but a bit left, bifurcates at the lower border of the lumbar vertebra 4. This is the bifurcation. This is the beginning. This is the aortic hiatus. We are seeing left crus of the diaphragm, right crus of the diaphragm, and this is the continuation of the descending thoracic aorta. This is the bifurcation at the lower border of the lumbar vertebra 4, and it is at the level of the highest point of the iliac crest. We have the branches of the abdominal aorta: celiac trunk, superior mesenteric artery, inferior mesenteric artery, inferior phrenic artery here, and we have the middle suprarenal artery, renal artery here. This is the renal artery. These are the gonadal artery, maybe testicular artery, maybe ovarian artery. This is inferior mesenteric artery, superior mesenteric artery. This is the lumbar arteries, and this is the median sacral artery. Okay, so we'll go to the relations of the abdominal aorta. Anteriorly, body of the pancreas, splenic vein. This is the aorta here. This is the splenic vein. The horizontal part of the duodenum, posteriorly left lumbar vein. On the right side, inferior vena cava. This is the inferior vena cava here on the right side. Cisterna chyli, a gyrgos vein, right crus of the diaphragm. On the left side, the left crus of the diaphragm. Okay. So what are the branches of the abdominal aorta? With the ventral branch, unpaired gastrointestinal tract is the area where they supply. Celiac trunk supplies the part of the gastrointestinal tract which are derived from foregut. It has three branches. One is the splenic artery, another is the left gastric artery, another one is the common hepatic artery. It supplies the gastrointestinal tract up to the opening of the hepatopancreatic duct. Superior mesenteric artery supplies the part of the gastrointestinal tract which are derived from the midgut. It supplies up to the splenic flexure. The inferior mesenteric artery supplies the splenic flexure of the large intestine, the descending colon, the sigmoid colon, rectum, upper part of the anal canal. Vertebral level, T12, L1, L3. Lateral branches, these are paired branches. They supply urogenital and endocrine organs like middle suprarenal, renal artery, gonadal, testicular, ovarian arteries. These are the vertebral level. Posterolateral branches are paired like inferior phrenic artery that supplies the inferior surface of the diaphragm, plus it also supplies the suprarenal gland by suprarenal arteries. Lumbar artery may be 4 or 5 pairs, vertebral level L1 to L4. Now this is what? Dorsal branch of the abdominal aorta. This is a midline structure of the near the bifurcation of the abdominal aorta. What is this artery? This is the median sacral artery. It supplies the rectum, sacrum, and coccyx, and it anastomoses with the iliolumbar artery and lateral sacral artery. So here we have to write the median sacral artery. Okay, we got that. These are the branches of the abdominal aorta: celiac trunk, superior mesenteric artery, inferior mesenteric artery. We have the gonadal branches, either ovarian or testicular arteries. We have the renal artery here and bifurcation at the level of the lower border of the lumbar vertebra 4 and also highest point of the iliac crest. And we have the median sacral artery that is coming just above the posterior aspect of the bifurcation of the abdominal aorta, and this passes over the sacrum and coccyx and it anastomoses the iliolumbar artery and lateral sacral artery. This is the median sacral artery. Okay, here we are just comparing the relationship of the aorta to the inferior vena cava. This is inferior vena cava. This go to the right atrium of the heart through the vena caval opening of the diaphragm. Vertebral level is T8 and it passes over the lumbar vertebra, but it is a bit right, and the left side will get the abdominal aorta. And its formation is at the level of lumbar vertebra 5, but in case of abdominal aorta bifurcation, lumbar vertebra 4. Okay, so we'll go to the clinical anatomy. Aortic aneurysm. What is aneurysm? Aneurysm is the abnormal dilatation of the blood vessel. This is the aneurysm. It is easily palpable. Even normal pulse in a thin person is easy to palpate because lumbar vertebra has a forward convex curvature. So the aorta can easily palpate it. It is around 2.5 centimeter below to the umbilicus, a bit left. This is the aorta. So in case of aneurysm, it will be dilated and that may rupture with severe pain and fatal outcome. So its management by 2A, by open abdomen from incision from xiphoid process to the symphysis pubis, then repair. Another one, the present day, is the endovascular approach with minimum invasion and only short stay in the hospital. Okay, so we got the branches of the abdominal aorta. It's begin at the T12 and at the lower border of the lumbar vertebra 4 into two common iliac arteries. Those are the terminal branches. So that's all about the anatomy of the abdominal aorta. If you have any question, please feel free to ask me. Please share the information with your friends. And please support my channel. Please subscribe me. Have a nice day. Bye now.